All right, everyone, it is time for us to get started. Welcome and thank you so much for attending today. My name is Alex Zorowski. I'm a public health educator with Washington Poison Center. So this is day 3 of our overdose awareness series this week. So far this week, we've had a presentation on opioids, as well as one on other drugs and substances of concern. Today, we're joined by Isabell Sakamoto with Seattle Children's Hospital, as well as our very own Dr. Erica Liebelt, Medical Director of the Washington Poison Center. And they're going to discuss safe medication storage and disposal, as well as teen substance misuse. Now, even though this is only a 5-day-long series, overdose awareness and prevention is one of the pillars of the Washington Poison Center. It is our hope that this week will not only increase awareness and knowledge of the dangers of overdose, but will increase awareness of Washington Poison Center services. And at the end of the day, a reminder to everyone that we are here to help. Without further ado, take it away, Isabell.
Thank you. Thank you to the Washington Poison Center for inviting me to share a little bit about safe medicine storage and disposal, and thanks to all of you in attendance today. So I'm Isabell Sakamoto. I'm the Suicide and Injury Prevention Program Manager at Seattle Children's Hospital. A piece of my work is centered around safe medicine storage and disposal with a particular focus on children and teens. So we work with community organizations, medical providers, patient families, and families in the community to offer education on this topic with the intent to prevent accidental ingestion or misuse of medicine in the home. And so just a few reminders before we get started. Please feel free to go ahead and ask questions in the chat box during this presentation. A reminder to please stay muted, although I think all of you are already muted. And then just an FYI that the recording will be shared after today. So I'd like to start with highlighting injury deaths on a national level. You may or may not know that the top leading cause of death for all age groups, 1 to 44, is unintentional injury. This chart is from CDC Whiskers that outlines specific types of injury across all age groups. Unintentional injuries are captured in the colored boxes on this chart. This includes unintentional poisoning in green. And as we can see, unintentional poisoning is a leading cause of death for all age groups starting at age 10. So throughout this presentation, I will be referring to medicine misuse, which includes taking someone else's medicine, taking too much medicine, or taking medicine in any way other than how it was prescribed. This may include mixing medicine and alcohol or other drugs. Misuse can lead to physical dependence and addiction, and as we learned in Monday's presentation, prescription pain medications are the most common avenue of opioid addiction. The thing is, children and teens don't always realize the dangers of medicine misuse or may misunderstand what it is. And so a common misperception is that prescription drugs are safer or less harmful to one's body than other kinds of drugs, but we know how harmful they can be, and youth who misuse prescription medicine are more likely to report use of other drugs. Problematic misuse of medication may begin during the teen and young adult years, and patterns established in youth often continue into adulthood. In fact, the majority of adults who are treated for opioid use disorder first reported using opioids when they were younger than 25 years old. So what are teens in Washington state reporting regarding prescription drugs and opiates? This is some information pulled from the 2018 Washington State Healthy Youth Survey, which is conducted every 2 years with Washington high schools. And so the information here is comparing surveys between 2016 and 2018. So according to the 2018 Washington State Healthy Youth Survey, it looks like misuse of prescription drugs and use of pain relievers to get high decreased among 12th graders, which is of course a good thing, but we did see that for 8th and 10th graders, misuse remains stable. Almost one in 10 teens perceive prescription drug misuse to have little to no risk of harm, which is a concern. Approximately 3,000 students in 12th grade reported use of painkillers to get high in any given month. Most teens report that their parents feel it is very wrong to use prescription drugs not prescribed to them. So overall, use of opioids remains a serious concern. And while I don't have all the answers as to why teens experience medicine misuse, we can start to understand the issue by exploring risk and protective factors. So just for context, risk factors are defined as characteristics or conditions that increase the likelihood of experiencing an adverse health or quality of life outcome, while on the other hand, protective factors are the characteristics or conditions that decrease or mitigate the likelihood of experiencing an adverse outcome, or in other words, or increase the likelihood of experiencing a positive outcome. So essentially, protective factors kind of help mitigate against some of these potential risk factors. I think it's important to consider both components as a public health approach to preventing injuries and other public health problems or concerns. These are only a few examples of factors that could increase risk for prescription drug use, as well as factors that help mitigate those risks. This is by no means an exhaustive list, and I've noted some resources near the bottom of the slide for additional information if you're interested in learning more about risk and protective factors. When I look at this information, some of the things that stand out are lack of knowledge and easy access to medicine at home, and then parental monitoring and engagement. So this sticks out to me, especially considering parents, caregivers, guardians of children and teens to help prevent misuse. And so when we talk with parents about how to support children and teens to protect from misuse, we suggest starting with a conversation. So that's this pillar of engagement that we see here, taking opportunities to have conversations with kids about the dangers of taking medicine that's not prescribed to them, and really keeping those lines of communication open. I do refer a lot to prescription medicines. I think it's also an important conversation to have with over-the-counter medications as well. It's not, prescription medications are important, but so are over-the-counter medicines to keep locked up and let kids know the dangers of misusing them. We have secure storage, which is about restricting access to medicines by keeping them locked in a safe or other lockable box. Again, this includes over-the-counter and prescription medicines. Active monitoring is like keeping an eye on medicines in the home, taking note of the number of pills and bottles and pill packets, and keeping track of use and refills as well. It is a good idea to supervise teens as they start taking their own medicines, as parental monitoring has demonstrated less opioid misuse among adolescents. And then finally, we have safe disposal. So encouraging proactive safe disposal of leftover medicine as a critical component to misuse. So all of these strategies work together to decrease medicine misuse. I'm just going to speak a little bit more to secure storage and safe disposal. And so the safest way to keep medicine stored is to lock them up where others cannot easily access them. For young children, storing medicine up in a way is a good practice, but locking up medicine is ideal, especially as kids get older. Most teens and young adults who report abuse of prescription medicine say they get it from friends, family, and acquaintances. So just kind of thinking about not only your own children, but kids who visit your home. These are a few different examples for medicine, ways to store medicine securely. Up here in the top left, we have like a lockable box that uses a key. It looks like it's made of steel and just stores some medicine, standard medicine prescription bottles. To the right on the top, there's this combination lockbox. And then at the bottom, we have a locking bag that may be useful for travel or to just keep in the home. So some things to consider when looking for medicine locking devices are kind of standards for them, durability, price range, and then some other things too that I'll mention. As far as I've been able to find, there aren't clearly defined standards for personal medication locking devices like the ones that we just saw, but you might want to consider one that's foster care approved or recommended by a reputable organization like a youth and family services organization, poison centers, or hospitals. You'll want something that is durable, not easily broken into. Externally facing latches on some boxes can be quickly pried open with a flathead screwdriver and locked back into place to make it appear as though it was never tampered with. So that is something that I would just say to keep in mind when you are looking for them, depending on what, why you are, or if you have teens in the home. And then some bags have locks on them, either key locks or combination locks, but some of them can be really easily cut through with just a regular pair of scissors, even if they are advertised to securely store medicines. Overall, price ranges will vary, but you should be able to find something within that kind of $10 to $30 price range, depending on your needs. And then, of course, size will also vary. Just for some idea, an 8x6x4 lockable box would hold approximately 12 standard prescription bottles. And then another consideration too is to use a combination lock as opposed to a keyed lock if possible, and if it works for you, just because keys are easy to lose and kids often know where keys are kept. And the other thing to consider is if you need to take medicine daily or someone in your family does, just thinking about portability of a locking device. So maybe like that bag would be good to have on hand, but just trying to think about how to safely store medicines ahead of travel. And when medicines are no longer needed or expired, just encourage disposing of them as soon as possible and in a safe way. So there are different ways to do this. You may want to participate in a drug take-back day. These are usually offered a couple of times a year, and the next National Prescription Drug Take-Back Day is slated for October 24th of this year. Also, of course, using a medicine disposal kiosk or drug mailback. So pictured here on the left is a disposal kiosk from Med Project that you might see at a clinic. Many pharmacies have some form of this kind of kiosk as well. And then you may use a disposal product like there's a brand called DisposeRx. Some pharmacies provide it when they provide prescriptions. This is basically an at-home medication disposal packet for oral medications. You just mix it with water and it breaks down the components of the drug. And then you can always ask your pharmacy or local police or sheriff station if they'll accept prescription medicines or if they have ideas on how you can dispose of them safely. This map on the right-hand side shows where pharmacies and law enforcement agencies accept both controlled and non-controlled substances throughout the state of Washington. And you can find this at takebackyourmeds.org. So if there's a medicine disposal kiosk or drug mailback option available in your community, that's ideal. But if you're in a pinch without easy access to these options, you can try some DIY disposal. And essentially this would be finding a container that has a lid and adding something inedible to the container. So some people suggest using like kitty litter or coffee grounds, something that people are not, that's going to be completely unappealing. And then adding those whole pills to that mixture, closing it, and then placing the container in the garbage close to trash collection day. Just And then making sure that the trash is not easy for people or pets to access if at all possible. And also just a reminder that when you do empty those pill bottles, if you have labels on there, just be sure to remove them so you don't have your personal information available in the trash or you've recycled it. So I'm just going to conclude with a few final considerations. So it's best to not flush medicine down the drain or toilets. This does protect the environment and keeps harmful substances out of the water supply. Of course, never share medicines with anyone else. Just a reminder, again, to remove personal information from prescription bottles, so those labels that tend to be on there, or pill packets before throwing away the container. And then we can all encourage friends, relatives, and neighbors to safely store and dispose of their medicines too. References. Again, the slides are available, and then I welcome any questions.
Thank you so much for all of that, Isabell. Folks, please feel free to use the chat box to provide any comments, questions before we transition to other elements today.
If you think of questions that come up later, my email address is here too, so you can feel free to reach out at any time.
Looks like there is a question here, Isabell. Where can anyone dispose of needles?
That is a really good question. I mean, it kind of depends, I guess, on where you're located. I'm not 100% sure off the top of my head. I know I'm thinking of like some of the disposal boxes that sometimes you see in like public bathrooms. I've seen them in like library bathrooms and things like that too. There may be some law enforcement agencies that would take those back. I can't think off the top of my head exactly like where those would be properly disposed of, but I know, yeah, it's a completely like separate location than medicines. Be happy to look more into that.
Oh, and there's a comment here that says you can check with the health district in your area.
Nice, thank you.
And I do want to make the point too with the mailback envelopes. You will need to differentiate if you are mailing back medicines like in pill form versus an inhaler, because they require separate mailback envelopes for that. So the website will prompt you through all of that. So it should be fairly clear, but mailback envelopes, they do not accept vitamins, supplements, and some other substances. So it's important to check what their requirements are. And Take Back Your Meds, which lists all of the different pharmacies, sheriff departments, et cetera, all those different secure medicine return locations. It will also list on the website for that particular location if there are any restrictions on what you are able to return or not.
Yeah, thank you.
There's another comment here in the chat box that says, in Spokane, you can dispose of needles at the Valley Waste Plant by packing them in a safe container. They suggest a detergent bottle or milk jug, and dropping them during a designated time. Spokane County Library District also collects them in their restrooms. Thank you for that.
Mm-hmm.
Well, I encourage you all to continue submitting questions that you have. I think Alex and I are going to start diving into this next section, but Isabell is going to remain online for the full hour. So if you think of anything else as we are going through things, please feel free to pop them in the chat box and we will all be here to answer them. So Alex and I decided that it would be a good idea to go through some of our data at the Washington Poison Center on child and adolescent poisoning, just to really cement and re-emphasize the importance of safe storage and disposal. So we're going to start with just a little bit of historical context with our data, just to show you that even though today we have really focused a lot on adolescents, and we will continue to focus on adolescents throughout the rest of the presentation, safe storage and medicine disposal is really important for other age groups as well, particularly young kids. So this chart shows opioid cases by age from 2015 to 2017. And you'll see that those bars on the far left are all exposure cases in little kiddos, so 0 to 5 years old. So they're all around 170 to 250-ish cases per year. So these kiddos probably aren't taking opioids, so they're likely getting into these medications at home through either a parent or caregiver having them and leaving them out or not securely storing them. So it's really important to prevent exposures in these little ones by ensuring that things are locked up, stored out of sight and away, out of reach, and disposed of when they are unneeded or expired. Alex, I don't know if you have anything else to add to that.
I will just give the qualifier that for poison-centered data, this may not reflect all exposures that happen in this category for this year across the entire state of Washington. This reflects folks who called us. So there is no mandate that requires that anyone who has a given exposure to anything has to call the Poison Center. So just keep that in mind as we go through the Poison Center specific data. There is that limitation. We cannot extrapolate to the entire state's trends or anything like that.
Great, thank you for that clarification. Yeah, so these are not all of the opioid cases in 0 to 5-year-olds in Washington, just the ones we were called about. Okay, so we're going to focus more on adolescents now. So we have some graphs here on this slide that show just the trend over time of our self-harm and suicidal intent cases within children and adolescents since 2014. So you'll see that over time they have been increasing, and that for both age groups, the majority of cases have been in females. So just keep that in mind as we go into this next section where we're going to look at more recent data and talk about how COVID has affected these exposures. So Alex, do you want to go ahead and describe this?
Yeah, sure. So this shouldn't be news to anyone. We've all been in this pandemic for months now, but it's helpful to bring it back, I think, because it affects so many realms of our lives. So one of the massive hallmarks of COVID and our prevention response to COVID, trying to protect ourselves, our families, and each other, is this increased stress and isolation, staying home more, not like a lot of folks are starting school now, and by and large, it has been remote or hybridized. So there's this increased isolation from folks. There's a lot less interaction. There's increased stress of constantly having to add these new filters of, oh, I've got to wash my hands after this. Ooh, I need to take off my mask when I come home and wash that, and all sorts of stuff we have to deal with now that we're not used to as much. And anytime we have more stress and more isolation, there is an increased risk of anxiety, of depression. And by extension from that, there is this increased risk of substance use. Some of these risks are very simply because we're trying to not go out as much. There's a lot of stockpiling. So folks may be trying to stockpile on supplies, that can be cleaners as well, in addition to medication, so they don't have to go out into the pharmacy as much. Where that's a concern here is that more medication in the home means more chance to access that medication when one shouldn't, whether that's intentional or unintentional. There's also the potential for decreased access to support systems right now. And I think that applies to everyone. And in some ways, especially kids right now, especially adolescents, again, because so many are starting school in a way that they really haven't before. There is that, even though we're able to do this, we're able to use Zoom, to use, in this case, GoToTraining and all these other platforms to engage, there is still a barrier. There's still many barriers there. And with that, there is this increase in academic stress potentially. Like having to learn new ways to learn is always difficult, especially when you're in the thralls of adolescence. Is there anything you want to add to that, Megan?
I think that's everything. Thanks. So with all of that in mind, we've been thinking about this since the start of the pandemic and have been really worried that poison exposures would increase due to all of those different factors. So over the last few months, we have been diving into our call data to look to see what trends there have been in exposures. So we've put together a series of snapshots so far, which Alex, would you mind putting the link to the webpage that has all of those snapshots in the chat box so people can access it? We don't have time to go through all of those different snapshots today, but we are, since we're talking about teen misuse, we're gonna show you some of our data and explain some of our call data around adolescent self-poisoning. So these are intentional exposures in adolescents ages 13 to 17 years old. So just as we were concerned about and worried about going into this pandemic, cases of adolescent self-poisoning have indeed increased. So the data in this chart, or in the snapshot that this comes from, compares the first 6 months, so January 1st to June 30th of 2019, to that same time period, the first 6 months of 2020. Just to see how these trends have changed during the pandemic. So sure enough, self-harm and suicidal intent cases among 13 to 17-year-olds has increased by 5%. Abuse cases, which are also considered as intentional cases, have increased 34%. So the difference with from self-harm and suicidal intent to abuse is that abuse is defined as wanting to get high, using a substance for its to get effects from it, essentially. So if you remember to those graphs that I shared earlier about how females were the predominant demographic with these intentional exposures, that has continued in 2019 and 2020. Alex, anything more to add on our self-harm data so far?
The only other thing is the caveat I mentioned earlier with, I think we feel fairly comfortable making the assumption that we're seeing these increases because of all these COVID measures, and with the nature of our data, we can't conclusively prove that or anything like that. So just always that grain of salt.
Yes.
Other than that, go for it.
Yeah. So, and again, people, I'm going through these very quickly, so please send us questions if you have specific things that you want to learn more about. And we do have our executive and medical director on the phone, so she's able, or on this webinar, so she's able to explain some more of this call data that Alex and I might not be as familiar with. So what are the top substances that are involved in these intentional cases? So the top box area is all of our self-harm and suicidal intent cases in adolescents, so 13 to 17-year-olds. The orange substances were the top 5 in 2019, and the blue substances are the top 5 in 2020. So what we find really interesting here, and what really underlies what Isabel was talking about earlier, is that over-the-counter medications are the top 2 for both in 2019 and 2020, ibuprofen and acetaminophen. And a lot of times there's a perception that over-the-counter medications aren't unsafe because they're readily available, they're easily accessible, you can buy large quantities of them, but these are showing up as the top substances in the self-harm and suicidal intent cases in adolescents. So it really underlines the point that all medication needs to be safely stored and disposed of if it's no longer needed. In 2020, the other top substances in self-harm and suicidal intent cases were antidepressants and then atypical antipsychotics. Alex, anything else on these substances?
I think you covered it really well, and this is setting up a lot of what Dr. Liebelt will talk about momentarily.
Go for it.
All right. So wait, are we transitioning now?
If you want to talk about the abuse substances.
Oh, my apologies. Sorry, folks. Yeah, so we are looking again at this chart here. There hasn't been too much of a shift between the 2019 substances and the 2020 abuse cases. And again, we're defining abuse as that desire to seek out intoxication or to seek out that high. And yeah, they haven't shifted too much. And most of these are very accessible. Some of them are, require prescription or have, like cannabis, marijuana has an age limit on it. That doesn't mean that youth are not accessing them.
And if you're interested in learning more about some of these substances like DXM, dextromethorphan, always a mouthful, our pharmacists that we had yesterday and our drugs of concern beyond opioids, they talked about DXM significantly and provided a lot of good information about that substance. So that presentation was recorded and posted on our YouTube channel. So I encourage you to watch it if you weren't able to attend yesterday and learn a little bit more about these drugs of abuse beyond just opioids. So if you all have any questions, please let us know. We're going to switch now to our executive and medical director, Dr. Liebelt, who is going to talk a little bit about diphenhydramine overdose. So it's been in the news a lot lately with the Benadryl challenge. So we wanted to provide a little bit more information about that. So without further ado, we'll turn it over to her. Again, ask any questions that you have in the meantime.
All right, we've unmuted you, Erica, so go for it whenever you're ready. Well, and Megan, switching presenter over to you.
Okay. Well, good afternoon, everybody. Well, Megan is getting my slides up. I appreciate the opportunity. And again, I think the transition into what I'm going to talk about is very timely, given that many of you may have seen in the news something on YouTube that's gone viral, the Benadryl challenge. Now, Benadryl is an over-the-counter medication. The generic name is diphenhydramine, and that's what I'm going to refer it to. But I got interested in this medication about 4 years ago when we started seeing an uptick of cases being called to the poison center, and primarily in the adolescent population. And I'm going to show you some slides about a research study that I was part of. And Megan, do you have those slides available?
Oh, do you not have your PowerPoint open? I can share it on my screen for you.
Oh, no, I'm sorry. I didn't bring it up. Would you like me to bring it up, or?
Here, I can just share mine. I have the PDF open.
Okay,
so.
okay. All right. And
sorry, folks, bear with us.
So this study was done by a University of Washington emergency medicine resident, Dr. Tony Nemanich, who is now a toxicology fellow in Chicago, as well as Dr. Amber Sabatini, who is a professor in the emergency department at UW, as well as myself. And again, had some background statistics that many of you are very familiar with regarding suicide rates, which have steadily increased in recent decades. And as a pediatrician, I'm very concerned about the rates of suicide among 10 to 19-year-olds, which have increased over 50% from 2007 to 2016. And these rates are even more significant in adolescent females. And that's why we decided to do that snapshot report last year on adolescent intentional exposures, as well as our most recent intentional adolescent exposures during the COVID pandemic. Next slide, please. So overdose of prescription medications is now the leading cause of injury-related mortality in the US, but certainly there have been a lot of public health consequences resulting from the abuse and overdose of common over-the-counter medications. And I think this sometimes, as Megan and Isabel both commented on, is sometimes goes under-recognized. And next slide, please. And diphenhydramine, which a lot of us know as Benadryl, is a very, very common over-the-counter drug. But it has a long history of being misused and or abused even before the Benadryl challenge came about in the last couple months. But in the last probably 5 to 6 years is being used even more as a medication that is taken in overdose for self-harm and for suicidal intent. It's found in many, many different formulations. It actually has a very interesting history. It has FDA approved indications as a sleep aid, but I think most of us think about Benadryl being used for allergic reactions. It's an antihistamine. And as you saw on our previous DASH report in that table, many times it's formulated in combination with acetaminophen, like Tylenol PM, or other different medications like dextromethorphan, which is also a very common over-the-counter medication that is abused. And again, as Megan said in the presentation yesterday, we heard about that. But what about the toxic effects of diphenhydramine? Next slide, please. So just to lay the groundwork in some graphs I'm going to show you, and Megan also mentioned this briefly, using poison center data, we have very standardized definitions on how exposures get categorized. And that's very, very important because there's 55 poison centers in the country, and all poison centers upload our data to a national poison data system. So it's important that how we categorize intent or reason for exposures is the same across all poison centers. In addition, we have standardized definitions for severity of exposures and for what constitutes serious adverse effects. So when we talk about intentional exposures, we talk about intentional misuse, intentional abuse, and suspected suicide. Severity of exposures, we have mild, moderate, major, and death. And then we categorize clinical effects or adverse effects that occur in cases we are called about. And some of those that are particularly relevant to diphenhydramine are cardiac arrhythmias, seizures, hypotension, which means low blood pressure, respiratory failure or arrest, which means you stop breathing, and or a cardiac arrest. Next slide. So what we did is we looked at trends in rates of diphenhydramine intentional exposures by different age groups. We used National Poison Data System data from 2005 to 2016, and looked at ages greater than or equal to 10 years. And I can tell you that when we actually broke out data by Washington State alone in our data, the graphs looked almost exactly the same. But I'm going to show you the national data. And this is data that we presented at a scientific meeting about a year and a half ago. So I'd like to call your attention to the orange graph line, ages 15 to 19 years. And when we took all intentional diphenhydramine cases, which were almost 159,000 for all poison centers, what we saw was 111% increase over this time period. And you can see how the line significantly increased around 2011. And we have some speculation about why that may have occurred in that year. But also look at the purple line. These are the pre-adolescents, the tweens just getting into the adolescent period, ages 10 to 14. Look at that significant increase in intentional diphenhydramine cases that we saw, an over 200% increase. Next slide. In addition, we looked at the relative change in percentages by reason and age. And I call your attention to where the orange arrow is pointing in the 10 to 14 year age group. We saw a significant increase in cases of 10 to 14-year-olds who ingested diphenhydramine intentionally for self-harm or as a suicide attempt. Now, we did see this, a increase also in 15 to 19-year-olds, that 119 relative change, again, for self-harm and suicidal attempt. These graphs are very, very disturbing to me, and I think point to a significant public health issue that, again, has been brought to the forefront by adolescents now challenging each other to get high by taking lots and lots of Benadryl. All right, and the YouTube Benadryl challenge video, explicitly shows that. We have modalities now where this type of behavior can spread very, very quickly, because when you look at the relative change for the abuse, it still was quite high for both of the age groups during this time period. And again, these bar graphs, they look almost exactly the same for Washington State data compared to national data. Next slide, please. We also looked at age and sex adjusted trends. And again, we looked at major adverse events. So again, and look, what is this telling us? That as the rate of these intentional overdoses and abuse cases went up, so did the severity of the exposures. So you remember I defined the major adverse events. And again, we saw a 39% increase in these type of adverse events. So seizures, low blood pressure, respiratory failure. And again, those exposures categorized as moderate or severe also went up. In addition, we saw a 3.6% death increase across all age groups, not just adolescents. And I didn't actually The number in the adolescent groups was very small, but present. Next slide. So again, what is concerning? Benadryl can be prescribed, but most diphenhydramine or Benadryl can be obtained over the counter. It's easily available, it's legal. You know, what is happening? Why are we seeing this increase in this population? Again, as Alex mentioned, the factors during the pandemic, but even before the pandemic, societal pressures, stress among youth and young adults. You know, I've talked to some of these kids as a pediatric emergency medicine physician. Why did you choose Benadryl? Because they feel stressed and, you know, they had a recent breakup or a relationship, you know, problem, and they wanted to take Benadryl as a sleep aid or to kill themselves because they could get it. They didn't need a prescription. The 2011 inflection point that I pointed out to you, we saw increases of other overdoses in 2011, similar to many other studies that have been published on not only adolescent self-poisoning, but self-poisoning in general. Why 2011? We can only speculate. Social media started taking off, Facebook, smartphones were becoming very, very popular and very, you know, most very available, and more kids and adolescents had smartphones. And then the recent TikTok social media modality, you know, making a very, very strong presence in our adolescent and young adult population. I also question whether there's the impact of the opioid epidemic and crisis, whether there's been a transition, again, in not seeking out opioids, but seeking out more readily available medications that you can buy at your drugstore or any of your large super chain stores. Next slide. You can buy in bulk. You know, this is a photo, thank you, Megan, from Costco. And you can buy these tabs in bottles of 600 count. And many times we get people, including adolescents, who ingest an entire bottle of this medication. And there's really, you know, no restrictions on who can buy these types of products. Next slide.
I think that's it.
I think that's the end. So anyway, I think that this all ties together, you know, with Isabell's initial presentation about teen misuse of medications, and how, you know, we can branch off from that, and the importance of secure medication return, safe storage of medications, not only to prevent unintentional exposures in young children who may be in the same household, but also to think about adolescents and availability of medications laying around the house or medications in large quantities that can be readily available. So I will end there. Thank you very much. And here's go ahead, Alex. Thanks.
Oh, thank you. Again, as we said earlier, folks, please ask any and all questions in the chat box. We're getting close to the end, but we do have some additional resources just to go through, and these are in the PDF, which you can download there. So we have a few different resources for self-harm listed throughout here. There's this text line through Teen Link at the top. And then these other resources are more about learning the larger risk factors and protective factors, as well as warning signs, ways to communicate, because there's so much to suicide prevention. In addition to having strong communication with loved ones, there's access to healthcare, there's access to mental health care. There's so many factors, and both this first link here, as well as the University of Washington's Forefront, have a great deal to provide. Next slide. And there's also the National Suicide Prevention Lifeline. Now, this is for in the moment crisis. We encourage, folks can reach out for help there, as well as 911. So for immediate help for yourself, for another, following self-harm, just instantly call 911. It is important to remind folks of the Good Samaritan Law. So many times folks are afraid to offer help because they think they might get in trouble somehow. This can, I think, be especially true with youth who may be using substances they're not legally old enough to use. And so we've heard many stories, Poison Center's gotten many calls on folks who had dropped a friend off at the hospital, but just on at the curb kind of thing, rather than like actually following through fully. Washington is protected by the Good Samaritan Law, so you will be protected if you are witnessing a drug overdose and try to intervene. And as a reminder, we're just over halfway through now, this larger series on overdose. So tomorrow morning, we are going to be joined, by pharmacist Nicole Ria with the Washington State University. She'll be discussing Narcan and other medication-assisted treatment. And then Friday, we're going to wrap things up with Dr. Scott Phillips, who's also with the Washington Poison Center, for a morning presentation on drug economics. And I believe that's contact info. So please let us know if you'd like, if you can't access the slides for whatever reason, any issues accessing the recording, if you have any other questions or feedback. As Megan said earlier, we're always adapting and growing and evolving our education, and so we want to, if there's a resource we didn't include that you find excellent, let us know. We'll include it next time. All right, I think that's the end of the slides. Perfect.
Yeah, that's the end of the slides, everyone. So if you have any questions, we still have about 5 minutes left. We're happy to spend some time diving a little deeper in any questions you have. Also, if you're interested at all in having any presentations for your organization or for your community, Alex and I are very happy to present and tailor presentations to you. So please just reach out to us via email. It's a lot easier now to present across the state since we're so virtual. So just let us know. So be on the lookout for a follow-up email in the next day that will include a link to the recording for this presentation, as well as a link to an evaluation. And hopefully it will have worked this time, but you should also have a certificate of attendance attached to that email. We've been having a little bit of tech issues the last couple of days, so if you have any problems with that, please just email me, and we're happy to create a certificate for you.
Well, it looks like most folks are starting to log off. We'll remain on the line for just another minute or so. Thank you to all the thanks.
And thanks to Isabell again for joining us on this series.
Absolutely.
Thank you.
2:56. I think maybe we give it till 2:57 and then we'll log off. I never want to be that guy who cuts it right as someone's typing the last thought. But again, you guys are always welcome to reach out to us after the fact. All right, clock says 2:57 on my end. Perfect. Well, thank you all so much. We hope to see you tomorrow and Friday. Bye, everybody.
Thank you, everybody.